Hello, my name is Carrie Johnson, and today I am going to read over the informed consent for an MGH clinical research study that I just newly enrolled into on August 25th, 2025. The protocol title for this clinical trial is Modulation Effect of tACS on Chronic Low Back Pain with Principal Investigator Jian Kong. The description of the subject population for this clinical trial was adults with chronic low back pain between the ages of 18 to 60. On page 1, I will start at the top about this consent form. Please read this form carefully. It tells you important information about a research study. A member of our research team will also talk to you about taking part in this research study. People who agree to take part in research studies are called subjects. This term will be used throughout this consent form. If you decide to take part in this research study, you must sign this form to show that you want to take part. We will give you a signed copy of this form to complete. Key information. We are asking you to be in a research study. This form will tell you what you should expect if you agree to be in the study. You will find more information about each of the following points later in this form. It is your decision whether or not to join the study. We are asking you to be in the study because you have indicated that you have chronic low back pain. We are doing the research to investigate the effect and brain mechanisms of tACS, which stands for transcranial alternating current stimulation treatment. If you agree, you will be asked to undergo 12 tACS treatment sessions, 2 MRI scans, and 2 EEG-MEG sessions. You will be in the study for 5 weeks if you decide to stay for the whole study. The main risks of being in the study include temporary and minor tissue soreness from application of pressure stimuli on the leg and or tingling, itching, and other sensations during tACS administration. So that is the first page, and on August 29th, I did my first brain MRI and was given instructions that there will be a brain MRI at the start of the clinical trial, and then towards the end of the 5 weeks there will be the second brain MRI scheduled. So I will be in this study for 5 weeks, and I was told that there is going to be three sessions that I will be doing in person of these transcranial alternating current stimulation treatments that I may or may not receive. So that is the first page of this informed consent. Now let's go on to page 2. You might benefit from being in the study because you may experience pain relief after receiving tACS treatment. Additionally, the study will yield knowledge about the mechanisms of pain, which will help in developing translational research that will assist clinicians in making adequate choices to relieve their patients' pain. You will be paid up to $500 through a mail check for taking part in this research study. You will find more information about the payment amount for each visit and a plan if you do not complete all study visits later in this form. You can call us with your questions or concerns. Our telephone numbers are listed below. Ask questions as often as you want. Jian Kong, MD, MPH, is the person in charge of this research study. You can call him at area code 962-0978, or Monday through Friday from 9 a.m. to 5 p.m. at area code 617-726-7893. You can also call the research coordinator at area code 617-726-5004, Monday through Friday, 9 a.m. to 5 p.m. with questions about this research study. If you have questions about the scheduling of appointments or study visits, call the research coordinator at area code 617-726-5004. If you want to speak with someone not directly involved in this research study, please contact the Mass General Brigham IRB. You can call them at 857-282-1900. You can talk to them about your rights as a research subject, your concerns about the research, a complaint about the research, any pressure to take part in or to continue in the research study. Now I'm at the top of page number 3, detailed information. A description of this clinical trial will be available on clinicaltrials.gov as required by U.S. law. This website will not include information that can identify you. At most, the website will include a summary of the results. You can search this website at any time. Why is this research study being done? The aim of this study is to investigate the effect and brain mechanisms of tACS, transcranial alternating current stimulation treatment. This study may yield knowledge about the mechanisms of action of tACS stimulation on lower back pain. We believe that our findings will facilitate the development of new methods for treating chronic low back pain. Who will take part in this research? We are asking you to take part in this research because you have indicated that you have chronic low back pain. A total of 80 subjects will be enrolled in this study at Massachusetts General Hospital, Charlestown Navy Yard campus. Funding for the National Institute of Health is paying for this research to be done. What will happen in this study? The study consists of 1 baseline clinical and behavioral assessment, 2 MRI scans, 2 MEG-EEG sessions, 12 treatment sessions, and 1 post-treatment clinical and behavioral assessment. Each treatment session consists of tACS stimulation and a simultaneous standard continuous performance task. Each treatment session will last about 30 minutes, except for the first session in which a 3-minute EEG. I'm sorry if I stumble upon my words. I'm nervous and I'm not usually recording myself while reading out loud, but let me read over this sentence again at the bottom of page 3. Each treatment session will last about 30 minutes, except for the first session in which a 3-minute EEG will be performed before and after tACS administration. Subjects will be randomly assigned to one of the 2 treatment groups, 1 active tACS or 2 sham tACS. A sham procedure is a faked intervention that is indistinguishable from the real intervention. You and the study doctor cannot choose your study group. You will have a 1 in 2 chance of being assigned to any of the 2 groups. tACS, transcranial alternating current stimulation, safely applies weak electric current to your brain. A cap with electrodes will be placed on your scalp. This current modifies your brain waves and facilitates effective communication between specific brain regions. When the stimulus starts, Now I'm at the top of page 4. You might feel a tingling or itching sensation underneath the electrodes. That sensation is not painful and goes away in seconds. If you choose to take part in this study, we will ask you to sign this consent form before we do any study procedures. The order of the sessions is as follows. Session 1 includes baseline clinical, psychiatric, and behavioral assessments. The clinical assessments include questionnaires that are designed to assess subjects' pain severity, day-to-day functioning, and quality of life. The psychiatric assessments are designed to examine if tACS treatment has any positive effects on mental health. The behavioral assessment will involve pressure pain administration, in which a series of pressure stimuli will be delivered to your right lower leg using a cuff inflator, and you will be asked to report subjective pain intensity ratings from 0 to 10. Session 2 and 3 involves an MRI and MEG/EEG session. Session 2 will be performed at least 24 hours after session 1, and session 3 will be performed at least 24 hours after session 2. EEG/MEG session. Okay, so I definitely cannot pronounce this medical term. So the abbreviation is EEG, and then MEG is another medical term that is very long that I cannot pronounce. But it measures brain activity. Electrodes and sensors will be placed on and around your head to acquire EEG/MEG data. Number 2, or II in parentheses, MRI session on page 4 We will take detailed pictures of your brain during an MRI scan. An MRI uses a strong magnetic and radio waves to take these pictures. Functional magnetic resonance imaging, fMRI, examines your brain activity during the scan by measuring your blood flow with a magnetic field. Since MRI uses a large magnet, people who have certain metal implants cannot have this scan. You will be asked to remove all metal items before the scan. The MRI scanner is a large machine. The MRI scanner is a large machine shaped like a tube. You will lie on a narrow table and will be moved into the MRI tunnel. The tunnel is slightly larger than your body. You will be asked to lie still during the scan. The MRI makes loud banging noises as it takes pictures. We will give you earphones to reduce the noise. You will be able to hear and speak to the research staff at all times during the scan. We can stop the scan at any time if needed. Session 4 through 15 are identical tACS treatment sessions, and each will last approximately 30 minutes. Sessions 16 and 17 consist of post-treatment clinical, psychiatric, and behavioral assessments, in addition to MEG-EEG and fMRI sessions identical to the baseline session 1. Now I'm on page 5 at the top. How may we use and share your samples and health information for other research? The information we collect in this study may have advanced, let me start over. The information we collect in this study may help advance other research. If you join the study, we may remove all information that identifies you. For example, your name, medical record number, and date of birth, and use these de-identifier samples and data in other research. It won't be possible to link the information or samples back to you. Information and or samples may be shared with investigators at our hospitals, at other academic institutions, and uh, ugh, let me start this sentence over again, stumbling. Information and or samples may be shared with investigators at our hospitals, at other academic institutions, or at for-profit commercial entities. You will not be asked to provide additional informed consent for these uses. Do you agree to let us store and use your samples and health information for other research related to chronic low back pain? And in this particular situation, I said yes. Going on, still on page 5. Will you get the results of this research study? You and your doctor should not expect to get information about the results of the research study or the results of your individual participation in the research study. We will study samples and information from many people. It could take many years before anyone knows whether the results have any meaning. There is a small chance that could find out something from the study that might be important to your health. If this happens, we may contact you to find out if you would like to learn more. However, even if we find something important to your health, we cannot guarantee that you will be contacted. What are the risks and possible discomforts from being in this research study? MRI scan. MRIs use powerful magnets to make images. There are no known radiation risks associated with MRI. However, persons with metal implants, such as surgical clips or pacemakers, should not have an MRI. All credit cards and other items with magnetic strips should also be kept out of the MRI room. People who feel uncomfortable in confined spaces, claustrophobic, may feel uncomfortable in the narrow tube. The MRI makes loud banging noises as it takes images. So now I'm at the top of page 6. Earplugs can be used to reduce the noises. The MRI can be stopped at any time at your request. If you are or suspect you are pregnant, you should not participate in this study. The MRI has the potential during normal routine use to cause localized warming of your skin and the underlying tissues. You should immediately inform us if you experience discomfort due to warming, and the procedure will be stopped. Some people experience dizziness or rarely nausea when going into a MRI scanner, and these sensations may be more common in scans with higher magnetic fields. In most cases, these symptoms only last a short time. However, some people may experience them throughout the scan and or continue to experience them for a short period of time. After generally less than half an hour, no case of permanent problems is known. The MRI scan being done is designed to answer research questions, not examine your brain medically. This MRI scan is not a substitute for a doctor who a doctor would order. It may not show problems that would be picked up by a medical MRI scan. However, if we believe that we have found a medical problem in your MRI scan, we will ask a doctor who is trained in reading MRI scans, a radiologist, to help us review the scan. If the radiologist thinks that there may be an abnormality in your MRI scan, we will contact you and will help you get medical follow-up for the problem. If you have a primary care doctor, we can contact your doctor with your permission and help him or her get the right follow-up care. You help you get the right follow-up care for you. No information generated in this study will be part of a routine hospital record. However, if the study detects an abnormality in your MRI scan, then this information may become part of the MGH hospital record. It is possible that you could be unnecessarily worried if a problem were suspected but not actually found. tACS. tACS is an investigational device that does not pose a significant risk to participants. The participants may experience tingling, itching, and other sensations during tACS administration. Pressure, pain. We may apply pressure cuff pain during the imaging scan, which may cause bruising. However, in this study, the maximum pressure values to be utilized are below those associated with tissue injury. All subjects will undergo repeated assessment of subjective response to brief 40-second noxious ischemic stimuli. The application of the pressure cuff may cause minor tingling in the skin and will be discontinued if intolerable pain is reported. EEG. Measuring brain waves through an EEG is not associated with any known risks. It is possible that there may be some skin irritation from the gel. It is possible that there may be some skin irritation from the electrode gel. Now I'm on the top of page 7. Questionnaires. You will be asked to fill out a set of psychiatric questionnaires. If you feel uncomfortable, you can choose not to answer some of the questions. Board certified physicians will be available to answer any questions you may have or to consult with you in the unlikely event that evidence of a psychological disorder is found. Medical information. There is a small risk that your confidential medical record could be revealed or discovered by mistake due to human error. Information about your taking part in this study won't be placed in your medical records, nor will the results of the research. In addition, your samples and information will be coded, and the key to the code kept in a separate locked file. We won't release or publish any information in a way that will identify a specific person. Email correspondence. The Mass General Brigham standard is to send the email securely. This requires you to initially set up and activate an account with a password. You can then use the password to access secure emails sent to you from Mass General Brigham. If you prefer, we can send you an unencrypted email that is not secure and could result in the unauthorized use or disclosure of your information. If you want to receive communication by unencrypted email, despite these risks, Mass General Brigham will not be held responsible. Your preference to receive unencrypted email will apply to emails sent from this research group / study only. What are the possible benefits from being in this research study? There may be no direct benefit to you. However, you may experience low back pain relief from tACS treatment. The study is likely to yield knowledge about the mechanisms of action of tACS. This knowledge in turn may help in developing translational research that will help clinicians and patients make adequate choices to relieve pain. What other treatments or procedures are available for your condition? Your alternative is not to take part in this research study. Taking part in this study is completely voluntary. You are free to stop taking part at any time. It will not affect any medical care you may receive. Alternative treatments from chronic low back pain may include exercise, weight loss, stress management, relaxation, physical therapy, or acupuncture pursued outside of this study. Now I'm on page 8. Can you still get medical care within Mass General Brigham if you don't take part in this research study or if you stop taking part? Yes. Your decision won't change the medical care you get within Mass General Brigham now or in the future. There will be no penalty and you won't lose any benefits you receive now or have a right to receive. We will tell you if we learn new information that could make you change your mind about taking part in this research study. What should you do if you want to stop taking part in the study? If you take part in this research study and want to drop out, you should tell us. We will make sure that you stop the study safely. We will also talk to you about follow-up care if needed. Also, it is possible that we will have to ask you to drop out of the study before you finish. If this happens, we will tell you why. We will also help arrange other care for you if needed. Will you be paid to take part in this research study? Each patient will be paid $20 for session 1 and $50 for MRI or MEG EEG session, $15 for each of 12 tACS treatment. Subjects who complete all sessions will be paid additional $50 with total of $500. Those who do not complete the study will be paid by sessions they participated in. Subjects who drive to their study visit will be offered a parking voucher. We will provide reimbursement for public transportation costs at the subject's request. We may use your samples and information to develop a new product or medical test to be sold. The sponsor, hospital, and researchers may benefit if this happens. There are no plans to pay you if your samples or information are used for this purpose. What will you have to pay for if you take part in this research study? We will not bill you or your insurance company for any part of this study, as all scans and study supplies are paid for through the study fund. Now I'm on page 9, the top of page 9. What happens if you are injured as a result of taking part in this research study? We will offer you the care needed to treat any injury that directly results from taking part in this research study. We reserve the right to bill your insurance company or other third parties, if appropriate, for the care you get for the injury. We will try to have these costs paid for, but you may be responsible for some of them. For example, if the care is billed to your insurer, you will be responsible for payment of any deductibles and co-payments required by your insurer. Injuries sometimes happen in research even when no one is at fault. There are no plans to pay you or give you other compensation for an injury should one occur. However, you are not giving up any of your legal rights by signing this form. If you think you have been injured or have experienced a medical problem as a result of taking part in this research study, tell the person in charge of the study as soon as possible. The researcher's name and phone number are listed in the beginning of this consent form. If you take part in this research study, how will we protect your privacy? Federal laws require it. Mass General Brigham to protect the privacy of health information and related information that identifies you. We refer to this information as identifiable information. In this study, we may collect identifiable information about you from past, present, and future medical records, research procedures, including research office visits, tests, interviews, and questionnaires. Who may see, use, and share your identifiable information and why they may need to do so. Mass General Brigham researchers and staff involved in this study. Mass General Brigham researchers and staff involved in this study. The sponsors of the study and people or groups it hires to help perform this research or to audit the research. Let me read that again. Gosh, the sponsors of the study and people or groups it hires to help perform this research or to audit the research. Other researchers and medical centers that are a part of the study, the Mass General Brigham Ethics Board or an ethics board outside of Mass General Brigham that oversees the research. Now I'm on the top of page 10. A group that oversees the data, study information, and safety of the study. Non-research staff within Mass General Brigham who need identifiable information to do their jobs, such as for treatment, payment, billing, or hospital operations, such as assessing the quality of care or research. People or groups that we hire to do certain work for us, such as data storage companies, accreditors, insurers, and lawyers. Federal agencies such as the U.S. Department of Health and Human Services, DHHS, and agencies within DHHS like the Food and Drug Administration, the National Institutes of Health, and the Office for Human Research Protections, state agencies, and foreign government bodies that oversee, evaluate, and audit research, which may include inspection of your records. Public health and safety authorities, if we learn information that could mean harm to you or others, such as to make required reports about communicable diseases or about child or elder abuse. Other researchers within or outside Mass General Brigham for use in other research as allowed by law. Now at the bottom of page 10, some people or groups who get your identifiable information might not have to follow the same privacy rules that we follow and might use or share your identifiable information without your permission in ways that are not described in this form. For example, we understand that the sponsor of this study may use your identifiable information to perform additional research or various products for example, we understand that the sponsor of this study may use your identifiable information to perform additional research on various products or conditions to obtain regulatory approval of its products, to propose new products, and to oversee and improve its products' performance. We share your identifiable information only when we must, and we ask anyone who receives it from us to take measures to protect your privacy. The sponsor has agreed that it will not contact you without your permission and will not use or share your identifiable information for any mailing or marketing lists. However, once your identifiable information is shared outside Mass General Brigham, we cannot control all the ways that other users, let me go ahead and read this over again, this last sentence. However, once your identifiable information is shared outside Mass General Brigham, we cannot control all the ways that others use or share it and cannot promise that it will remain private. Because research is an ongoing process, we cannot give you an exact date when we will either destroy or stop using or sharing your identifiable information. Your permission to use and share your identifiable information does not expire. The results of this research study may be published. I'm so sorry. Let me read this last little paragraph here at the bottom of page 10. The results of this research study may be published in a medical book or journal or used to teach others. However, your name or other identifiable information will not be used for these purposes without your specific permission. Now at the top of page 11, your privacy rights. You have the right not to sign this form that allows us to use and share your identifiable information for research. However, if you don't sign it, you can't take part in this research study. You have the right to withdraw your permission for us to use or share your identifiable information for this research study. If you want to withdraw with your permission, you must notify the person in charge of this research study in writing. Once permission is withdrawn, you cannot continue to take part in the study. If you withdraw your permission, we will not be able to take back information that has already been used or shared with others, and such information may continue to be used for certain purposes, such as to comply with the law or maintain the reliability of the study. You have the right to see and get a copy of your identifiable information that is used or shared for treatment or for payment. To ask for this information, please contact the person in charge of this research study. You may only get such information after the research is finished. Informed consent and authorization. Statement of person giving informed consent and authorization. I have read this consent form. This research study has been explained to me, including risks and possible benefits, if any other possible treatments or procedures, and other important things about the study. I have had the opportunity to ask questions. I understand the information given to me. And then down here at the bottom of page 11, there is the signature of subject. I give my consent to take part in this research study and agree to allow my health information to be used and shared as described above. So at the bottom page of 11, that's the end. And then on page 12, it pretty much shows the signature of study doctor or person obtaining consent, statement of study doctor or person obtaining consent. I have explained the research to the study subject. I have answered all questions. I have answered all questions about this research study to the best of my ability. So that completes this informed consent that Daniel did not read with me on the first day of enrollment. He kind of pretty much had me sign the form, and that was the appointment that I thought that he was going to go ahead and read over it, and I just signed it. But here is the audio version of me reading over the informed consent for this newly enrolled clinical research trial, not a study, but a trial that takes part over the next 5 weeks that I'm going to be participating in, along with completing my academic studies. So this completes the audio recording. Thank you and have a wonderful day.